Hi there, my name is Jeff Kale, and I'm the founder of the Retiring on a Budget group. And what this group is about and why it was founded, it's seniors helping seniors. I'm very passionate about this. There's no hidden identity. And when I say that, my information is out publicly, so you know who's running the group, who you're dealing with. The group is private, so what you share in the group stays within the group. There's no politics, no hyperlinks, no bullying, no promotion, and no spam for sure. And we do everything we can to uphold all of these guidelines, and it's done for your protection. So our group culture is very important. What sets us apart? We're the group with a heart. And I sincerely mean that. We want this, not only do we want to provide you with great information, but we want to create a group culture that is caring, safe, supportive. We want our members to show kindness and respect to other members and encourage as we go along here. So it's really about seniors helping seniors. So with that, that's enough for me. I'm going to introduce Danielle Roberts. Oh my gosh, guys, I got to tell you something. I do not endorse companies. You're never going to hear me. I shouldn't say never. You're probably never going to hear me endorse a company. I'm going to endorse and put my seal of approval on Boomer Benefits. Boomer Benefits is the company that I used to get set up with Medicare. I didn't know anything about it at all. And I got a hold of them, and I was so fortunate. They walked me through the entire process and got me going quickly. So we have here the co-founder of Boomer Benefits, Danielle Roberts. She's a Medicare expert. She has a best-selling book. I'll let her tell you about that. She's going to go into presentation, and then there's going to be a live Q&A session. So, and this is exclusive. She's doing this exclusive to this group here. So with that, I'm going to turn it over to Danielle. Let me stop sharing. Okay. Okay, you're good to go.
Good.
Take it
Okay.
away.
Well, thank you for the lovely introduction, Jeff. That warms my heart to know that my team has done such a good job for you. As founder of Boomer Benefits back in the day, 20 years ago, when my brother and I started this agency, we didn't know that we would grow to have a team of 200 people here in Fort Worth, Texas, servicing Medicare beneficiaries all across the nation in every state except for New York. And so it's been a great journey. And one of the things that we really wanted to build as we grew Boomer Benefits was sort of hand holding with Medicare so that you're never alone in dealing with Medicare. And that's because most of the time, when people we meet them and they're turning 65, they feel pretty overwhelmed. They have a desk or kitchen table with mails foot high stacked. They're afraid to throw things out because they don't know what is the solicitation, what are they supposed to keep that's actually from Medicare itself. And it can be truly overwhelming. So today, what I'm going to do is eliminate all of that confusion for you. I'm going to talk to you about the parts of Medicare and what they cover, what they don't. We're going to talk about how and when to enroll in Medicare. We will for sure cover what Medicare costs, being that this group is all about retiring on a budget. We'll make sure that you know what to expect in terms of spending that you'll have on your healthcare in retirement. I will for sure walk you through some of the pitfalls that you need to avoid. And then, of course, I'll wrap up with some things that maybe other people wouldn't tell you and how you can work with my team absolutely free so that you also will never be alone in dealing with Medicare. Our agency was founded back in 2005, and in addition to teaching webinars like this one for consumers and beneficiaries, I also am a CE instructor. I teach an 8-hour course for agents here in Texas who want to work with Medicare beneficiaries. So my knowledge is pretty deep from both aspects there, from the broker side and then also from what people need. You can read more about us after the webinar at our website. We have over almost 30,000 five-star reviews. And this fall, you may see me and hear me on your local podcasts or TV stations. I tend to do a lot of press right before the annual election period. And all of this just to share with you that I do have a very deep, deep knowledge on Medicare. I'll be able to answer any questions you have at the end of the webinar. And then we're also going to give away a book at the end of the webinar. The 10 Costly Medicare Mistakes book is a book that I wrote in conjunction with my client service team in reviewing thousands and thousands of our case files to see, what were the mistakes that people who are new to Medicare coming into Medicare tend to make all the time that people before them also made on Medicare. And we wrote a book to try to address those most important things. It's large print, and if you're not the lucky winner today, you can pick it up for $10 on Amazon. It's a great tool as well. And then lastly, something you may not know about Boomer Benefits is I do a lot of advocacy. So I'm in DC several times a year lobbying Medicare. I have a trip planned to DC at the end of October where I'll be talking with various legislators on several initiatives that I think are really important for beneficiaries, including how Medicare coordinates with COBRA, trying to allow for Medicare people to contribute to HSAs if they're still working, and a lot of other things like that. So we take it to the next level when we say that we are fully behind trying to make Medicare easy for you on all fronts. So one of the things I want you to know about Medicare is it is not necessary to invite a stranger into your home these days to have them sit at your kitchen table and show you how to do Medicare. That was the way we did business 20 years ago, but everything in the industry has changed now, and you can do all of this business over the phone just like you would for auto insurance or homeowners insurance. I'll also tell you that there are quality ways to support your coverage, even if you have a small budget. So I'm going to walk you through the different options you have, and some of them, one route may be right for one person, another route may be better for another person, but I'm going to show you the range of options you have for supplemental coverage and where they fall in terms of what you'll spend. And then we'll also tell you about how to avoid some of the mistakes. I actually have a couple of items that are in my book in this webinar, and we'll make it really easy for you. So I like to say that Medicare starts with the parts because sometimes people dive into trying to learn about Medigap and Medicare Advantage before they even understand what they get from the federal government based on their work history here in the US. And you really can't decide how to supplement your coverage if you don't first understand the benefits that you're entitled to based on all of that work history. So let's dive into those parts. And we'll start with Medicare Part A, which is your hospital insurance. This is going to be things that happen in an inpatient hospital where you're spending the night in the hospital. So this could be doctors and nurses coming around to give you care. You're going to get 3 square meals a day, maybe some green jello if you're lucky at night. There's skilled nursing that may happen while you're in the hospital and also after a hospital stay. It's going to cover medications related to your stay. It will cover blood transfusions, and if and when needed, Part A is what also covers hospice benefits. And then everything else falls under Part B for the most part. Part B is your outpatient coverage. You want to think of this, as medical care that you get when you're not admitted to the hospital. So this, of course, is things that you and I recognize as outpatient, like doctor visits and lab work and preventive care. But there are things that fall under Part B that could happen on a hospital campus, but they're not part of an admission to the hospital. So they fall under Part B as outpatient. This could be outpatient surgery, physical therapy, limited home health care services, dialysis, chemotherapy, radiation, ambulance ride, MRIs and CT scans. It goes on and on. And so it's really necessary that you have both parts A and B if you don't have any other form of coverage, like, say, employer insurance because you're still working. These two are the foundation. And when you put them together, we call this original Medicare or traditional Medicare. So these two parts, A and B, are your original Medicare, and they are the only two parts that you get directly from the federal government. So they're the only two parts that you're going to sign up for at the Social Security website. Medicare Part C and D, they came much later in the Medicare program, and they are optional. These are choices that you will have, and I'm going to walk you through those in more detail today. Now, with Medicare Advantage, we're going to talk about that when I'm showing you the various ways that you supplement your Medicare coverage. And then Part D is considered a voluntary drug program, but in my book, we call it a optional sort of, because if you don't enroll in a Part D drug plan and you don't have some other form of creditable coverage like employer insurance or veterans benefits, you do start to accumulate a penalty that gets larger with time, so that later on when you finally join, you end up having a higher premium for the rest of your life. And so they like to call it voluntary. It's not really. And these two parts are offered by insurance companies, and you enroll in them through brokers like us at Boomer Benefits. Now, when you need to enroll in Medicare, for most people, is in a 7-month window surrounding your birthday. This starts 3 months before your birthday, it goes through the birthday month, and then it runs for 3 months after. And as long as you enroll within this window, you don't have to worry about any late penalties for Medicare Parts A and B. Now, you can delay enrollment into parts of Medicare with no penalty if you work for a large employer and you're going to continue working for them past age 65. And I'll show you much more detail about that here shortly. But everyone else who is retired and Medicare is going to be primary, this is the time for you to sign up. And the way that you sign up is either the Social Security website or the Railroad Retirement Board if you happen to have retired from there. Most people are going to go to www.ssa.gov, which is the Social Security website, and they sign up. Now, there's a small group of people who don't need to sign up for Medicare because they're going to be auto-enrolled. And this is anyone that starts their Social Security benefits prior to becoming eligible for Medicare at 65. You can take Social Security as early as 62. And if you do that, when you're coming up on your Medicare eligibility, they're going to say, look at this. Jane's taking Social Security benefits. She's probably not working. She probably needs health insurance, and we'll just auto enroll her. So your Medicare card shows up in the mailbox 1 to 2 months before you turn 65. But if you're like a lot of people who delay enrollment into into Social Security until their full retirement age or until age 70 to get that maximum monthly benefit, those folks need to enroll themselves at the Social Security website in this 7-month window. Now, you don't need an agent to help you with this part. It's very simple to go online and sign up for Medicare. It takes only a couple of minutes. And then once you're enrolled, you get your Medicare card, then you're going to be working with someone on our team or a Medicare broker that you know that you have selected to get you enrolled in the extras. Now, before I move on to Medicare cost and cost sharing, I wanted to point out to you that you might have noticed I didn't mention long-term care. And that is because Medicare doesn't cover long-term care. Medicare will cover a short-term facility when you have qualified after a 3-day hospital stay, and maybe you're in the skilled nursing because you're recovering from surgery. Maybe you have wound care. Maybe you had a stroke and you're getting some physical therapy. There's a very short-term window of that kind of skilled care. But what it doesn't pay for is rent to live in an assisted living facility or nursing home. And so this is something you want to plan for separately, either with your financial advisor or perhaps you purchase long-term care insurance for that. Just know going in that Medicare doesn't cover that. All right. So when we get to costs, lots of people, I think, with Medicare costs get really confused because of the different parts of Medicare. But the way I want to make it a little simpler for you is to tell you that the costs of Medicare are pretty similar to the cost of the health insurance you've had your whole life. So if you think about your current insurance, either that you have through an employer or if you're self-employed, maybe you have a plan through the healthcare exchange, every month you pay a premium to an insurance company, and that in return, that insurance company provides you with health insurance. So if you're still working, your employer probably pays this and they deduct a portion out of your paycheck. That's how you pay your share. If you have an Affordable Care Act plan, you're sending a premium to an insurance company because you enrolled on the exchange. So just like you've paid premiums your whole working life, you're also going to pay premiums for Medicare. There's nothing different there. Premiums exist just like they always have. And then if you think about your current benefits again, when you go to the doctor, go to the hospital, is everything free? Well, of course not. Here in America, we are very used to HMOs and PPOs where you go into the doctor and you pay a copay. You have an overnight stay in the hospital, there's going to be a deductible. That's called cost sharing. It's the cost that you pay as you use healthcare services. And Medicare also has cost sharing. So just like in coverage you've had in the past, there are premiums and cost sharing. So let's look at the premiums first. Medicare Part A, your hospital coverage, as long as you have worked 40 quarters in the US where you have paid FICA taxes, when you sign up, it will be premium free, meaning it won't cost you anything. And that's because all those years when you were working, they were pulling money out of your paycheck to prepay your future hospital benefits. Even if you don't have this work history, but your spouse does, or your ex-spouse does, if you were married for more than 10 years, or a late spouse had those work orders, you would qualify for premium-free Part A. So the result is that the vast majority of people pay nothing for Part A. Sometimes you run across people who are immigrants and they qualify for Medicare after 5 years, but they don't have the work history or their spouse doesn't have the work history. And those folks can pay for Part A, but it's quite expensive. It's over $500 a month. So hopefully you're on this call and looking at a premium-free Part A. And then for Part B, everyone's going to pay some form of premium. The standard base premium in 2025 is $185. This is projected to go up to, I think, 200 or 205 in 2026. And they'll usually announce those numbers toward the end of October. So most people pay this standard base premium. Some people may pay less if their income is so low and so close to the federal poverty level that they qualify for assistance from Medicaid. Those folks can get a lower premium. And then some folks will actually pay more than the standard base premium based on their income. So the way this works is when you are getting ready to enroll in Medicare, let's say that's happening here in 2025, the IRS sends over your tax file from 2 years ago to Social Security, and Social Security looks at what you earned 2 years ago, and then they send you a benefit determination letter in the mail that says, based on your income in 2023, here's what you're going to pay for Medicare in 2025. And you can see that if you were a single individual earning, say, 110,000 2 years ago, you would get a letter saying that Part B is $259 a month for you. Likewise, if you were a married couple and you had a joint income of 500,000, you would each pay $591.90 for your Medicare Part B. And what's important here is that decisions you make with your money when you are 63 and 64 will impact your premiums when you're 65 and 66. So it's important to know this because you may not want to cash in a 401k while you're 63 or 64 and cash it out in just 1 year and then have it inflate your premiums 2 years later. You could work with your financial advisor to maybe spread that out over a couple of years so that it impacts your Medicare premiums less. Also, things that might affect this is if your income changed, maybe you sold a house and you had a large capital gain, that could potentially inflate your premiums. And so it's important to know potentially what all of this going in so that you can ask questions and make good decisions and hopefully have a lower premium. Now, some of you might look at this and say, well, I did make that money 2 years ago, but I don't now because I've retired. No problem. There's actually an appeal form. If you're working with my team, we'll provide you the appeal form and walk you through how to submit it to Social Security. But if your income has changed because you retired or you're working part-time now, or you had marriage, divorce, death of a spouse, sale of an income producing property, all of these things would be a reason that you can appeal this charge, which is called an IRMA, an income related monthly adjustment amount. And you could get it lowered sooner than waiting that 2 years for that income to catch up to you. Now, we will talk about Part C Medicare Advantage plans in more detail in the next section, but let's jump ahead to Part D for right now. With Medicare Part D, this is again that voluntary coverage. This is a premium that you pay to an insurance company who helps you afford your medications. And these plans will be all over the place in premiums. They could set their premium as low as $0, and it could be over $100 a month. Every insurance company offering these plans, they get to decide how good they think their formulary is and charge you a premium accordingly. Now, when you enroll in Part D, Medicare pays the Part D company on your behalf. And so they could offer you a premium as low as $0 in some states because they want to attract your business. But they might also have a really robust formulary and they feel it's worth it to charge more. So if you average everyone in America that has a standalone Part D drug plan, usually alongside original Medicare and a Medigap plan, the average premium that most people pay is around $40 a month. But you may pay more or less depending on which medications you take, which are going to affect which plan you're going to choose, because you want to make sure to choose a plan that has the drugs that you need in that plan's formulary and then offers the preferred pharmacies that you like. With Medicare Part D, they also have an IRMA. So let's say you are a gentleman that we talked about earning $110,000 2 years ago. He would also see $13.70 a month being deducted from his Social Security check, and that's how he would pay the IRMA for Part D. So if he did have a $40 a month premium, he's going to send that to the insurance company that he chose, and whatever mode that he chose on his application, it could be bank draft or a coupon book, and then this additional IRMA gets deducted from his Social Security check. Now, where this gets tricky is you might have people that have pretty high income and they don't take a lot of medications, or they just take a few generics, and they're not too excited about paying a premium plus $85 a month in IRMA charges for something that they feel like they're not going to use. But if they don't enroll, then they're going to get hit with the penalty down the line. And so there's a balancing act there. We provide you all the data and you can make the best decision for yourself. But one plug that I would make for Part D is if you don't enroll when you're first eligible, you can't just sign up whenever. You may only be able to get into a Part D drug plan once a year during the annual election period in the fall. So if you were to get sick in February and you need an $8,000 a month oral chemotherapy med and you skipped Part D, well, you don't have any coverage for that year and you're going to pay those costs out of pocket until the next election period comes around that we can get you into a plan. And so I don't recommend skipping Part D for this reason, because of course we've seen some pretty sad cases where that backfired. But it'll be ultimately up to you to decide if that's something you want to choose. So those are the premiums you're going to pay. Now let's talk about what you would pay if you had just original Medicare and nothing else. Here's your cost sharing. Spend the night in the hospital, you'll have a $1,676 deductible. Now, you don't pay anything else unless you're unlucky enough to still be in the hospital on day 61, at which time you start paying an expensive daily copay that doubles on day 91. And on day 150, all of your benefits run out and you pay the rest of your hospital costs thereafter. You also pay for the first 3 pints of blood in a transfusion. And if you do get transferred to a skilled nursing facility, Medicare will cover you up to 20 days, but then after that, you can see you start picking up a pretty hefty daily copay. So when you're looking at these numbers, you start to see why back in 1965, when Medicare was rolled out, almost immediately companies like Mutual of Omaha created Medigap plans. And those plans step in to pay these costs on your behalf. So paying that hospital deductible, covering those daily copays, giving you an additional year of hospital coverage beyond the 150 days that Medicare covers. And then some Medigap plans you can choose will also cover that skilled nursing piece. Now, if you leave the hospital and you're out 60 days, Part A benefit period closes. Now you go back in 2 days later in the same calendar year, you're going to pay this deductible again. And so we want to have something for sure that is going to pick up that deductible so you're not coming out of pocket for it. On the Part B side, when you are using your outpatient benefits like doctor visits and physical therapy and lab work, on your first outpatient visit of the year, Medicare will process the claim and you will get a bill for the first $257 in outpatient services. That's how you pay the annual Part B deductible. And then after that, Medicare covers 80% and you pay 20% of the remainder of your outpatient services for the rest of the year. The problem here is there's no cap on the 20%. So unlike insurance that you've had while you were still working, where you have a deductible and then a stop loss to protect you, there's no stop loss on Part B. So if you needed a lifetime of dialysis or several rounds of chemotherapy, this 20% could be a staggering amount of money, and it's probably the most important thing that we want to make sure that we get covered. So let's talk about ways that you get that coverage. One is if you're still working. And when you're still working, the way that Medicare coordinates with your employer insurance is going to be based on the size of the employer. So if you or your spouse works for a large company, a company that has more than 20 people, and you are covered under that group health plan, that group coverage is going to be primary and Medicare secondary. So you can delay enrollment into Medicare without any penalty, and you'll have a special election period to pick it up when you retire. So in this scenario, most people will sign up for Part A because remember, Part A has a zero premium, and it will coordinate with the employer group health insurance, and it could reduce your spending in the event of a hospital stay. However, sometimes we run into people who have a high deductible health plan and they're contributing into an HSA. Well, the IRS says you can't contribute into an HSA if you have any other form of insurance besides that high deductible plan, and Medicare Part A is a form of insurance. So if that's your scenario at a large employer, we would have you delay all the parts of Medicare, and then we help you enroll in all of them a few months before you're actually getting ready to retire. On the small employer side, things are opposite. So if you have small employer coverage, Medicare is primary and the group coverage is secondary. So if Medicare is going to be your primary coverage, you for sure want to sign up for Medicare during your your 7-month initial enrollment period. Because if you don't and you go in and you need a surgery, you get to pay the 80% out of pocket because you failed to enroll in Part B to pay it for you. Now, this also is the case if you have employer retiree insurance, Medicare is primary. If you have COBRA, Medicare is primary. And so in all of those scenarios, you want to go ahead and get signed up for Medicare right away. And pitfall number one is people miss this all the time. They have a friend that worked for a large employer, and that friend said, "Oh, if you're working, you don't need to sign up." And of course, the friend didn't know that it's different that if they work for a small employer. And so they fail to enroll and they end up with unexpected medical expenses. I'll also tell you that sometimes we have folks that have an Affordable Care Act plan through the healthcare exchange, and sometimes they're getting a subsidy that makes that coverage really cheap. It could even be cheaper than what it would cost them to be on Medicare, but it's not creditable for Medicare. So you can't stay on it. You need to leave that coverage and go on Medicare at 65, or you're going to run into some late penalties down the road. Now, in terms of things that Boomer Benefits provides support on, I want to kind of show you one of those pitfalls and help you avoid it. So whenever you leave large employer coverage when you are post 65 and Medicare has been paying secondary while the group coverage is primary, sometimes employers forget to notify Medicare that you've retired. So you go and sign up for your Part B and you get your Medigap plan, everything all set up, and you go to the doctor, you have some appointments, maybe some lab work and physical therapy or something, and you get a whole bunch of bills in the mail and everything is denied. And you will be like, "Oh my goodness, what has happened?" Well, what happened is Medicare is still paying secondary. So when it gets bills as primary, it just denies them all. And this is very overwhelming when it happens to people because they don't know what's going on. So what happens for folks that do their business through us is they're going to call and say, "I don't understand why all my bills got denied." And we're going to be like, "We probably know what happened. Let's make a call to Medicare." We conference you and we call Medicare. Sure enough, nobody notified Medicare that it was now going to be paying primary. Well, we fix that for you, and then we do all the work reaching out to the lab facilities, the doctors, and getting them all to resubmit the bill so that Medicare could pay primary and you end up with nothing out of pocket usually. And this is one that we fix a couple times a week for people. That's how common this one is. So an easy way for you to avoid needing us to even do this for you is when you retire, call Social Security or Medicare and say, "Hey, by the way, I've been working, I'm 68, I'm 72, but I'm getting ready to retire, and on June 1st, Medicare will be primary." If you give them that heads up, you can avoid this sort of coordination of benefits nightmare altogether. But this is an example of how it really helps to have someone on your side that knows what's going on, because it's a pretty easy fix for us, and we do all the legwork for you if you end up running into that. All right, let's talk about what your options are if you don't have employer coverage. So you turn 65, you've retired, Medicare is going to be primary. And we want to make sure that you're not exposed to those deductibles and coinsurance that I talked to you about a few slides back. So you have two options. You can go with a Medigap plan, also called the Medicare supplement, same thing, just two different terms. These have higher premiums up front and less cost sharing on the back end. You could also opt for a Medicare Advantage plan, that's that Part C of Medicare. These have much, much lower premiums, but higher and less predictable cost sharing on the back end. So they kind of are opposite from one another. And I'm going to walk you through just all the data so that you can start to get a feel for what you think makes sense for you. So with a Medicare supplement, this is a private insurance plan offered by an insurance company that covers the costs that Medicare leaves behind. So it's going to cover that deductible that I showed you. It's going to cover the 20% on the Part B. Depending on which Medigap plan that you enroll in, basically Medicare pays first, and then it takes the remaining bills that would normally go to you and it sends it to your Medigap company to pay on your behalf instead. And then you only get a bill in the mail if there's anything left over. And often with a full comprehensive Medigap plan, you'll have very little left over. Now, you must be enrolled in Medicare Part A and B to qualify to enroll in a Medicare supplement. When people choose a Medicare supplement, we typically find that it's because they like the freedom of access. So there's no network, if you will. Medicare itself is the network. So you can see any participating provider anywhere in the nation, no health questions, no referrals. You don't have to pick a primary care doctor. They don't have to refer you to see a specialist. And the only question you have to ask your providers is, do you take Medicare? If they say yes, then it doesn't matter whether your Medigap plan is with United Healthcare or Humana, Aetna, Cigna, Blue Cross, Anthem, Mutual of Omaha, Manhattan Life. I could quote you a bunch of carriers. It doesn't matter. All it matters is it's a Medicare supplement. It's going to pay exactly as I'm showing you here. So this works great if you're going to travel because you can spend a few months in Florida, or maybe you want to escape the heat and you go to Montana. Doesn't matter, going to pay wherever you go. And each plan has an exact set of benefits. So you can choose a Medigap plan that is really rich and robust, or you can choose one that pays some of the costs left behind and you pay some of the costs. It's going to be up to you. Lots of insurance companies offer these plans. We work with all the major ones that you might consider. So I'm going to show you a chart of the 10 Medigap plans. But first, I want to give a little public service announcement that Uncle Sam really wasn't very smart. Whoever decided to label Medigap plans with the A, B, C, D, F, G, K, L, M, N, because we already have Medicare Parts labeled with letters, Part A, B, C, D, and now we're trying to show people that there's a Medigap plan that you add to that, and those are also covered or named A, B, C, D. Really confusing for people. They should have used Roman numerals. But you might call and say, work with one of my team members, and you might say, Billy, I want a Medigap Part G. Well, there's no such thing in the world, but we're going to know what you meant. So what I will tell you to make it a little easier on this chart that shows the 10 different plans is that almost no one enrolls in Medigap Plan A, B, C, or D because of all these X's that you see. Those are things that are not covered. So on Plan A, that hospital deductible isn't covered. And so very few people will enroll in a Plan A because they want more comprehensive coverage than that. When you're living on a fixed income, typically you want to have coverage, though, that if you spend a week in the hospital, you're not worrying the whole time about the bills that are waiting in your mailbox when you get home. And so for decades, the top Medigap plan sellers have always been the ones that are the most robust. So currently, for people new to Medicare in 2025 and beyond, Plan G is the plan that offers the most coverage. So you can see here it covers 100% of all those gaps that I showed you, except for the $257 Part B deductible. You'll pay that on your outpatient visit. And then once that deductible is satisfied for the rest of the year, whether you have an outpatient surgery or chemotherapy or physical therapy or an MRI, Medicare pays 80%, the Plan G pays 20%, and you pay nothing. You don't even have a doctor copay. Your only copays will be on your Part D prescription plan. So Plan G is really the most comprehensive coverage that you could buy. And of course, because of that, it's also the most expensive. And we'll talk about premium examples in just a moment. We also get a lot of requests for Plan N, and that one has a little bit less coverage. You're going to pay a doctor copay, an ER copay, and some excess charges. But the premiums might be $20 or $30 a month cheaper than a Plan G. So we get a lot of people asking, could we run quotes for them for both of those plans? And of course we can. Now, if you're a high deductible health claim kind of person, you might look at this chart and say, well, I really like Plan K because I'm willing to pay half the deductible if my premium is going to be lower. And we'll look to see which insurance companies offer Plan K, and we can quote them for you. Not all insurance companies have to offer all of these plans. Some of them may only offer one or two of them, usually the most popular ones, but there's some state rules around some of the ones they have to offer as well. So this chart is something we would go over with you and help you determine, what meets your risk tolerance, and then we have a quote engine to determine which insurance company offers the best pricing. So when it comes to premiums for your monthly Medigap, the Medicare insurance company, they set the rates, and brokers like us, we can't change the rate. We can only quote the rate that exists. It's just like when I use an auto insurance broker. She goes out and she shops all the different plans, and she comes back to me and she might present Travelers and State Farm and Allstate, and she shows me the options, and I'm paying whatever premium that insurance company has set based on my age, my driving record. She's not inflating the rate. So the rate that you pay is exactly the same whether you enroll direct with an insurance company or whether you use a broker like us at Boomer Benefits. What does affect the rate is your age at the time of your application, your zip code, your gender, your tobacco usage, and whether you are eligible for any household discounts that that insurance company may be offering. And also where you live really matters. So in the Midwest and even here in Texas, the rates are pretty good for Medigap plans. But if you lived in, say, Florida, Connecticut, New York, Washington, in states like that, you might pay 2 or 3 times as much for a Medigap plan because the cost of healthcare in those areas is so much higher. So this is how your cost picture looks if you go with original Medicare, a Plan G, and a Part D drug plan. Part A we said is 0. Part B is 185, could be more if you have an IRMA, right? This is your original Medicare, it's your foundation. On top of that, you are adding a standalone Part D drug plan. We're going to use $40 as just a ballpark because that's the national average. You might qualify for a plan, or you might choose a plan that's less than that. We would help you determine which one is going to be good for you. And then if you were a turning 65 non-smoker here in Dallas Fort Worth, and female would pay around 120, male is going to be closer to 150. All of the insurance companies are going to have different rates, so we're going to run them all, and then we're going to look to see who's offering you the best rate for where you live. And we look at a couple of other things like their history of rate increases and their financial ratings, and we help you determine, kind of narrow down which insurance company we want to actually submit an application to. So for around $345 a month here in DFW, I can have a plan with a $257 deductible and 100% coverage after that. So just to put that in perspective, I'm almost 52 and I pay $600 a month for a $3,500 deductible, 20 times more than what the Medicare deductible is. And when I hit the deductible, I still owe 20% because it's an 80/20 plan. So I can't wait to enroll someday in a Medigap plan and pay this little for a plan with so much more coverage than I have now. All the same, there are plenty of people out there who are living on fixed income, and this may be not that comfortable for them. Also, with Medigap plans, you're going to have rate increases every year. So this premium is going to go up a little bit. We can shop it for you when that happens, but there's some state rules around changing plans. So when you first enroll in Medicare Part B, whether you do that at 65 or maybe you work all the way till you're 70 and then you sign up, you are going to be given a one-time window to enroll in any Medigap plan offered in your zip code with no health questions asked. They cannot turn you down, no underwriting. This happens once, starting with your Part B effective date, going for 6 months, and then it's gone. After that point, now if you apply for a Medigap plan in most states, they're going to look at a 2 to 5 year health history. They're going to pull your medical records, they're going to pull your prescription records, and they can accept you or decline you. So if we have someone call in to work with one of my team, the first question we're going to ask is, what is your Part B effective date? We want to know, where are you in the window? And if you are someone coming into Medicare with a chronic health condition, something treatable but not curable, insulin-dependent diabetes, congestive heart failure, MS, Parkinson's, rheumatoid arthritis, osteoporosis, we're going to know that we need to use the 6-month window to get you covered, because probably thereafter you would be turned down for a Medigap plan. And so this is really important that you understand this, because if you're going to go the Medigap route and there's some existing health conditions, we don't want to lose our opportunity to get you covered in that 6-month window. And so pitfall number 2 for this presentation is that people confuse the one-time 6-month open enrollment window for Medigap, which is specific to you and your Part B effective date, with this annual election period that you hear about in the fall. In the fall, from October 15th to December 7th, that period has nothing to do with Medigap plans at all. It is for changing your Part D drug plan or your Medicare Advantage plan if you have one, because those 2 types of coverage don't have any health questions, so they limit your enrollment to this one period every year to make sure that people sign up instead of waiting until they get sick to sign up for coverage. So we get people that were pretty healthy at 65, they didn't sign up for anything. Now they develop a health condition and they call on October 15th, they're like, yeah, I got to get a Medigap plan because I have these bills running up. And then we have the unfortunate responsibility of explaining to them, well, actually that health condition that you have is going to disqualify you from getting a Medigap plan. And so the analogy here is, you can't go out and buy better homeowners insurance if your attic is already on fire. And in most states with most Medigap plans, the same applies. They want to make sure that you purchase the insurance before you need it, so that these companies don't go belly up when everyone waits until they get sick to sign up for coverage. Now, there are some states with exceptions that I want to go over with you. And these are always changing. There's new ones coming on board all the time. But if you are planning to retire in one of these states, it will be helpful to you to know kind of what the open enrollment rules are there. So in New York, Massachusetts, Connecticut, and Vermont, no health questions ever. You literally can wait until you get sick and then go sign up for a Medigap plan. Now you have a 6 month pre-existing condition limitation, meaning it won't cover pre-existing for the first 6 months of that policy. But other than that, anyone can get one. The problem is in those states, because they can't underwrite out the sick people, they have to raise the rates on everyone. And so that's why somebody in New York will pay twice as much for their Medigap plan as somebody in Fort Worth, Texas. Now, there's some other states where there's either a birthday rule or an anniversary rule. And this means there's a window of time surrounding your birthday or your policy anniversary where if you already had a Medigap plan, then you can switch within that window. Let's say it's a 60-day window, like in California. You can shop that every year and you could switch to another Medigap plan with the same or lesser benefits, and there's no underwriting. But that's only if you already had a Medigap plan. So we're always updating the states where these things apply. And if you were to go to the Boomer Benefits website and search on guaranteed issue, there's a search bar at the bottom of our website. It will take you to a page where we go through each and every one of these and tell you exactly what the open enrollment looks like in that particular state. But in most states, you will not have an opportunity to enroll in a Medigap plan without underwriting. And you want to know those rules, of course, before you go in. So how do you enroll in a Medigap plan? There's two ways that you can go. Let's say that you wanted a Medigap Plan G from Blue Cross Blue Shield in your area. You can call the carrier and they will give you a quote based on your age, gender, zip code, tobacco usage, and eligibility for discounts. Let's say they quote you $150. Then you call Boomer Benefits and say, I want this Blue Cross Plan G. Can you give me a quote? We're going to quote you $150. The rate you pay is exactly the same no matter how you enroll. So what is the benefit to you of enrolling through a broker like us? Well, if you were to call the insurance company to enroll direct, they're not going to tell you if they have a cheaper plan than their more expensive plan than their competitor, right? When you go to Ford, they're not quoting you the Chevy prices. So you may not even know that there's the same Plan G available from a different insurance company for less. They're not going to tell you the rate increase history so that you can factor that into your decision. If you get a bunch of the bills in the mail because of a coordination of benefits issue or billing issue, where one of your medical providers used the wrong code and so something didn't get covered, you have to figure that out all on your own. There's no one that's going to help you with that at a big insurance company. We're not going to show you how to enroll in a Part D plan. If I'm an insurance carrier offering Medigap, I don't care about Part D. You have to do that on your own. And if you get a bill in the mail that you don't understand, you have to figure it out on your own. You're not going to be getting assistance from an insurance company call center. If you enroll in that same plan through Boomer Benefits, we're going to quote you all the carriers that are available in your zip code that we work with, which are the major ones. We're going to provide you the historical rate trends to help you determine which carrier you go with. We have a program that we hold your hand all the way through enrollment into Medicare Part D. If you need an appeal because something was denied, we help you with writing those. And also, we tell our clients, if you get a bill in the mail and you weren't expecting it and you don't know why you received it, don't pay it. You always call our client service team first. Let us take a look to see, is this a valid bill that you actually owe, or did someone use the wrong billing code and this is why this bill got rejected? And just since October of 2022, we have saved our clients over $3 million in claims just from the ones that our clients have called us about before they paid it. Very, very important. So basically, you're never alone in dealing with Medicare. I'll give you an example of kind of how we fight for our clients. So recently, we had a client that came to us, and he was on Cobra for a while before he turned 65. And then right around the month when he should have signed up for Medicare, he had an accident, a shoulder injury, and it required an emergency shoulder rotator cuff surgery. Well, he didn't know that once you turn 65, Cobra is no longer primary. Medicare's primary. And he failed to enroll in Medicare. It was probably the 1 month of his entire life that this man didn't have primary coverage because he just didn't know that Cobra goes from primary to secondary when you turn 65. And he missed his Medicare enrollment by 1 day because he was running around to doctor's appointments trying to get this surgery set up. So what happens? He gets $40,000 of bills in the mail from his outpatient surgery because he didn't have Medicare to be his primary coverage. Well, This has nothing to do with his Medigap policy. Frankly, it's not Boomer Benefits' problem, but that's not how we operate. We fight for our clients, not only on Medigap things and Medicare Advantage things or the policies you have with us, but in anything related to Medicare at all. So what we did was a three-prong approach. The first thing we did was we filed an application with Social Security requesting that they would backdate his Medicare by 1 month and showing them that he missed his enrollment by 24 hours because of the emergency that happened to him. That was chance number one. Chance number two is I went through all of my network that I have in Washington, D.C., got someone who knew someone in his congressman's office, got connected to their constituent department, told them what happened, and they said, let us call Social Security and we'll throw our weight behind your application to update that. That was my second chance. Third chance is I have a claims manager who walks on water. She really does. And she and I talked it over and we were like, why don't we help him write an appeal to the company that has his COBRA, explaining what happened and telling them they've been paying primary all this time. Could they please pay primary on this bill that happened in this 1 month when he first turned 65? Because he truly missed it by just not knowing any better. And then we wait. And we got a call from the company that we wrote an appeal to. And they said, yeah, that's a terrible situation. We understand and we're going to pay these bills. So for a few weeks, this guy was sweating that he was going to spend 40 grand out of pocket, but we were hitting it on all fronts trying to help him. And this time it was successful. So you're going to have all sorts of things like that happen with Medicare. They're usually going to be a lot smaller, like the example you see here. You get a bill for a few $100 or $1,000 or 99 cents. We don't care. If you weren't expecting it, like let's say you get a bill for $257, you might say, oh, this is my Part B deductible. That's why I owe this. And then you pay that. But anything you're not sure, you call us and our service team will walk you through and make sure that it wasn't some sort of error on Medicare's end or the lab end. Lab companies are notorious for using the wrong bill codes. And so we fix those all the time for people. Okay, so that's your Medigap route. Let's sum it up. Ask your doctor, do you accept Medicare? As long as they say yes, doesn't matter which insurance company we put you with, it's going to pay just like I've shown you here. Medicare pays first, then the Medigap company pays second. 10 standardized plans. They're guaranteed renewable, which means they can't drop you for developing a new health condition. The benefits don't change from year to year like they do on Advantage plans. So if you're a set it and forget it person, a Medigap plan may be a good fit. Don't forget, though, that they are going to have rate increases each and every year. So you want to know that over time, the cost of Medigap will go up. And then you just add on a standalone Medicare Part D drug plan. And one thing that's really cool now is Medicare Part D used to be really confusing. There was a donut hole, this hole in the middle where you had to really compare between different insurance companies, you know, what they were going to charge you on on your medications in the donut hole. Well, it's gotten a lot easier now. There's only 7 carriers offering Part D plans, where just a few years ago we had 22, which created a lot of confusion. And now all of the plans have a $2,100 cap. So we want to find a plan that has a low premium, but also covers the medications that you need. So one recommendation I have is don't just jump at the lowest premium plan. We want to look at that plan formulary and make sure it's going to cover the medications you need. It's important that you review that list before choosing. Okay, let's switch gears here and talk about Medicare Advantage plans. So a Medicare Advantage plan is your other choice. You would never have Medigap and Medicare Advantage. They don't work together. You'll only have one or the other. With an Advantage plan, an insurance company comes into the area where you live and they go around to a bunch of doctors and hospitals and they create a network, and those providers offer to see the members of this insurance plan at a discounted rate. Does this sound familiar? Yes, it's very much like group health coverage. So they'll create an HMO or a PPO network, and then you're going to see the providers in that network to get your care. So when you enroll in a Medicare Advantage plan, Medicare pays the Advantage plan over $1,000 a month to take on all of your medical risk. So these Medicare Advantage plans, they often offer really rock bottom premiums, even zero premium, because if you sign up for their zero premium plan and they get $1,000 a month from Medicare or more, if they can deliver your healthcare for less than $12,000 a year, they're going to be making money, and they make a lot of money because there's always more healthy people than sick people. With Advantage plans, the Part D is going to be rolled in on most plans. Around 97% of all Advantage plans have a built-in Part D drug coverage. Now, even if you find a plan with a zero premium, that doesn't mean that you're not paying the $185 for Part B. You're going to have Part A and B, and then you're adding a Medicare Advantage plan. So when you enroll in an Advantage plan, you don't want to go and cancel Part B because then your Advantage plan would also cancel. You have to be enrolled in both A and B to select either a Medigap plan or a Medicare Advantage plan. Now, the most common plans are HMO plans. We've all had these before. They're going to have a primary care doctor that you see for a referral before you see a specialist. But HMO plans typically have the lowest premium, the lowest copays, the lowest coinsurance, lowest out-of-pocket maximums. So if you're okay with the referral system, typically Medicare HMOs offer you the best pricing on your healthcare services. There are some PPO plans where you can be on the plan, and if you decided to go outside the network, you could, as long as that doctor was willing to bill the network. And you're just going to pay a lot more for seeing a doctor outside the network than inside the network. But there's no health questions. Anyone can sign up for this during their initial enrollment period or during an annual election period. And because they're all competing for your business, they throw in lots of extras. So you will see plans with maybe a limited dental, vision, and hearing coverage. They might cover eye exams. A lot of them will have a free gym membership or a flex card where you get so much money put onto this debit card that you can use for vitamins and minerals in their supplement shop, things like that. Now, because it's network based, if you need to have a big procedure, there's going to be something called a prior authorization, and you have to get that approved before the plan will cover certain services. And then even though the premiums are lower than Medigap, it doesn't mean that this plan is free, because what's happening is you're going to pay the cost sharing as you go. So we would sit down with you and go over the plan summary of benefits, and every plan will be a little different. But let's say we found a plan that had a zero premium and a primary care doctor copay of $5 or $10, depending on the plan. A specialist visit might be $25 or $30 or $50. Lab work might be a $25 copay or maybe $200 for an MRI. When you go in the hospital, it's really common for us to see something like $200 a night, but capped after 5 nights. And then some things, usually the most expensive things, you will pay 20% on an Advantage plan. And so because of that, Medicare requires all of the Advantage plans to have a built-in maximum out-of-pocket limit, so that if your spending on Part A and B services goes over that limit during the year, then for the rest of the year, the plan has to pay 100%. So in 2025, that maximum limit can be no higher than $9,350, but it can be lower than that. So if the plans are all competing for your business, if we can find you a Medicare Advantage plan and we confirm that your doctors are in the plan's network, your drugs are listed on the Part D formulary, and I can find a plan with a $5,000 maximum out-of-pocket limit, that's going to be a lot better for you than one that has the standard limit of $9,350. So with Advantage plans, it looks like this. Part A, we said, is zero. Part B, 185. Could be more if you have an IRMA. Part D is going to be built in, so you're not paying anything extra. There's no Medigap premium. And if you had a zero premium Medicare Advantage plan, you would pay $185 in total, because your Part B premium, there's nothing being added to it. So it's important to know that this route is cheaper, but remember, you're going to be paying for healthcare services as you go, unlike, say, a Plan G where Medicare pays 80% and the plan pays 20%. There is some potential for more spending on an Advantage plan in a year where you have more health issues going on. So you want to build a rainy day fund, that you have some money set away for a year where you might have more healthcare services going on. This way you're not panicking. You've already got emergency money set aside for that. You want to look for a plan with a low out-of-pocket maximum if possible. Our team will do that for you. We get your list of doctors, etc. And then how and when you enroll matters. Please do not enroll because a celebrity sports figure sits on TV and tells you about this amazing plan where everything is free. You're going to have a first class ticket to the moon the next time we go up, and tomorrow morning there's a pink Cadillac in your driveway. Those TV commercials are bait and switch gimmicks. they are going to offer you a plan that when you call, you will typically find that you don't qualify for because they talk about plans that you can only get if you have Medicare and Medicaid, which is for low income people. So once they get you on the phone, they say, well, you don't qualify for that, but we have this other great plan with less benefits. And then we're going to quickly enroll you in it. Let's go right now. 30 minutes or less, boom, you're enrolled. You have no idea what you just bought. And now you're locked into it, right? Because Advantage plans will have a lock-in period if you don't cancel before the start date. So you want to work with an experienced broker to sign up for an Advantage plan so that the due diligence happens. We check the doctors and hospitals. We want to make sure your preferred pharmacies are in the network. We want to make sure your drugs are on the formulary and that you can afford the cost on the plan. So with Medicare Advantage, excuse me, Texas allergies here. Um, it's private insurance that has a local network of providers, much lower premiums, but on the back end, you're going to have some copays. Part D can be included on most plans, and then they may have some extras like gym memberships. The benefits do change from year to year, so they're going to send you an annual notice of change in the mail in September, and you have to be willing to sit down and look at that to see if you liked your Advantage plan this year, what's changing on it for next year? Are they having a premium change? Is there changes to a specialist copay and you see a lot of specialists? Are they dropping one of your most important medications? You always have to do your homework on Advantage plans in September. But the trade-off, of course, is the overall spending. So on an Advantage plan versus a Medigap plan, you can see here, we add up all the costs over 5 years, might be over $11,000 in that scenario of a male turning 65 in Dallas-Fort Worth. Well, with an Advantage plan, you could do a zero premium a month. We could add a very inexpensive cancer plan to pay you cash benefits in the event of cancer because a lot of Advantage plans have that 20% co-insurance for cancer treatment. We want to make sure you have something to cover that. Some Advantage plans have high hospital copays, so we can get a little inexpensive hospital indemnity that we add to the Advantage plan so that that's also covered. Now you've covered two of the biggest out-of-pocket risks on an Advantage plan, and the cost over the years is still considerably less than Medigap. But you're opting for a plan that has a network and you don't have that freedom of access that you have with Medigap. So can you see how some people will immediately be attracted to one over the other because it fits their lifestyle or their budget? And there's no right or wrong here. But pitfall number 3 is people don't understand the difference. They hear a fancy TV commercial, they get all excited and they enroll in something having no idea what they bought. They don't know how to use their plan and find out that it doesn't, their primary doctor is not on the network or their hospital isn't in the network or one of their drugs isn't covered. And so it's really important that you do your research to enroll in something that's right for you. So we're going to wrap it up here in a minute. I'll take some questions, but just to give you a little bit of in closing, on the Boomer Benefits website, if you go to the blue taskbar, there's a drop down here that says Medicare resources. We have links to all sorts of videos that we've filmed for you. There are calculators and guides and glossaries to help you with your Medicare learning. And then if you decide you want to work with us, what I like to say is that my team doesn't just sell Medigap and Medicare Advantage. We sell what is the legendary Boomer Benefits experience. You're going to call, you're going to get a human being on the phone. You're going to talk with someone in our Fort Worth call center, no matter where you live in the US. They're going to have all this deep knowledge on Medicare and me to consult if there's a special case with all of my 20 years of experience. And they are trained better than any company out there. We invest thousands of hours of training into our staff to make sure that they're the most experienced, most legendary help that you can get. And of course, this is why we've saved our clients over $3 million in bills just since October of 2022. So that is what we offer you. If you decide that you want our help with working with your Medicare plans, you can certainly reach out to my team and you will get all of these things included for free, no charge to you. And then also after today, if you want to connect with us, just like you being in your Retiring on a Budget Facebook group, we have a Facebook group where you can join even before you're on Medicare. We have lots of 60-year-olds in the group that are just there learning in the few years before they turn 65. And you can ask questions of me and my team there, and we'll answer them for you 365 days a year. It's free and you don't have to be a client. So with that, I am going to stop the screen share here in just a moment. And then Jeff, should we have people perhaps put their questions in the Q&A box or should they unmute? How do you normally do this? Oh, I see some questions already.
Okay. Yeah, if you can see them, you can go ahead.
Okay, you got it. I see some people in here from Detroit. That's where my family's originally from. That's pretty cool. Let's see. Andrea says, I sold some land in 2024. Will this affect my 2026 Part B? It could. So if you had a capital gain, I believe that I don't know the tax numbers, but I believe if the capital gain is more than 250,000 or there's a limit to what the sale can be, if the gain that you had was beyond that limit, it can impact what you will pay for Medicare Part B. So depending on what that sale was, a lot of times people sell their primary home. That isn't necessarily something they make a huge capital gain on, but if you sell a vacation home or some land, yes, it could potentially impact that premium. Okay, what steps would I need to take with my mother's current insurance that is in New Jersey because I'm moving her to Maryland to live with me? That happens a lot, Dana. We run into that all the time. So it depends on the type of coverage. If she has a Medicare Advantage plan, that's going to be specific to certain counties and state where she lives. So if she's going to go from New York to Maryland, she's going to have to change the Advantage plan. There's a 2 month special election period to do that. You could call our team and we could walk you through. If she has a Medigap plan, the Medigap plan will go with her, but the premium will change based on the cost of healthcare in the area. So you'll call the Medigap carrier, give them the new zip code. Hopefully the premium goes down, but it is possible that it could go the other direction. So it'll just depend on the rates in that particular area. I'm working and I have good insurance. Can your team help me decide if I should switch or continue taking insurance? Yes, we absolutely can. So a lot of times, Phil, if you have employer coverage that's primary, we'll review it. And a lot of times we're going to tell you that you should just stick with what you've got. But we can recommend making sure whether you have A or B coordinating with that. But occasionally we do run across a plan where somebody's paying $500 a month and there's a $5,000 deductible. And it could actually be cheaper for you to be on Medicare and Medigap or an Advantage plan. And so we can look at all the numbers and we'll tell you which way to go. If you're good to go for now, at least you'll have a contact at our business that you can use for that later day when you finally retire. And then we can help you with everything at that time. Pam says, I live in an area that has cost plans. Can you tell me how they differ from Medigap and Advantage plans? So without getting too deep into it, the cost plans are not as popular, but there are still a few of them out there. Pam, if you would go to the Boomer Benefits website and just search on cost plans, we actually have a blog post that will walk you through exactly how they coordinate with Medicare, and then you can decide whether that kind of plan makes sense for you. May you please share the recommended book at the top of your presentation? Sure. It's actually 10 Costly Medicare Mistakes You Can't Afford to Make. And we'll do a giveaway here in just a moment. And I think also Jeff has a book that he offers as well. Is that right?
Yeah, everyone that stays to the end. And by the way, everyone has stayed to the end. Doesn't usually happen. So you've definitely
Awesome.
captivated this audience. But I'm giving away an ebook. It's 100 ways to save money in retirement. So
That's awesome.
everyone gets a copy of that.
Okay, great. I have been on the same Advantage plan for nearly 20 years without a broker or agent, but as my health changes and the plan change, it sounds like I may benefit from dealing with your company and services. Yes, that's possible. What I would do in that scenario is just reach out to us in the annual election period when you have a chance to change, and we'll take a look to see if you're getting the best plan for your money. If we find that that plan really suits you and you've got all the doctors are still in the network and it's going to be the lowest out of pocket, then we will tell you that you should stay with that plan. But if it makes sense, there's something that it would be a more cost effective for you, then we can help you with switching, and then that would be at the point we would become your agent. Let's see. Karen says, husband owns a business and we flip houses, so our Part B will be higher, then we'll go down in 2 years after we sell. Yes, so that's true. Let's say you flip a few houses, so you have this income and it all hits this 1 year. Well, two years later, you're going to get a benefit determination letter, and they're going to tell you exactly how that year's income impacts your premium for just 1 year of Medicare. So at the end of every year, you're going to get a new benefit determination letter from Social Security based on the next latest year from 2 years ago. So you could just wait for that cost to go down. You can wait the 2 years to catch up to you, and that premium will lower on its own. You also can appeal on certain things. If you flipped houses, that's not going to be a valid reason for an appeal. But for the rest of you listening, if you had an income change because you sold a property that used to produce income for you and now you don't have that income and you're going to actually have less, that is a good reason to appeal because they may lower that for you sooner. Does my wife enroll separately since she is a year younger? Oh, John Adams, what a cool name. My favorite figure from the American Revolution. I love everything about that man and everything he sacrificed for our country. Does my wife enroll separately since she's younger? Yes. So everyone's enrollment into Medicare is specific to them. There's never a joint policy of any kind. Well, you have your Medicare and your Social Security, and your spouse will have their separate. So let's say you're turning 65 and you go on Medicare. If that means your spouse is going to lose group health insurance through your company, she will have a special election period to enroll on the healthcare exchange and pick up an Affordable Care Act plan, which will bridge the gap until such time that she turns 65 and can join you in being on Medicare. So that is a way you would sort of cover that gap. She may have her own group health insurance though, and so you would go off onto Medicare and she can be on her company's. There could be a couple different scenarios there. My husband collects Social Security and I'll enroll in February in Medicare. I will not be eligible for his TRS anymore. And I'm also self-employed. The IRMA will apply. Turn 65 in December. I know it's going to be so expensive. Any advice appreciated. Yeah. So if you're self-employed and you have a high income, it is true that it's potentially going to impact your Medicare premiums. You would want to work with the financial advisor for perhaps how you are taking distributions out of things like a 401k and an IRA. Maybe those can be spread out over a period of time to potentially keep that as low as possible. If you're going to be turning 65 in December of 2026, I would say to give my team a call like next September, and we could start looking at all of the premiums for you at that time. Sometimes people contact us sooner than that because they just want the peace of mind of making contact, getting a name from someone on my team, having a person they can email a question to once in a while they're getting closer to Medicare, and that's totally fine too. But I would say probably no later than September of next year. Andrea says she's 65 in June. Do I need to work through June? No, not necessarily, because you could have Medicare start on the 1st of June. So when you're enrolling in Medicare during that 7-month initial enrollment period, if you enroll in the 3 months prior to your 65th birthday month, your Medicare is going to start on the 1st of the month in which you turn 65. If you enroll during the birthday month or in the 3 months after, then you're going to start your Medicare on the 1st of the month after you apply for Medicare. So you could decide to leave in May and you could have your Medicare benefits start in June, and that would work out okay as well. I'm 63, my husband's still working, and I'm on his insurance. When to apply for Medicare? So, Joanne, for you, you're not going to be eligible for Medicare until you're 65, of course. And so, if he's still working at that time, if it's for a large employer, remember that employer coverage will be primary and Medicare will be secondary. So, you can delay the certain parts of Medicare until such time that you retire. If it's a small company, then Medicare is primary, and you're going to want to sign up for Medicare right when you turn 65. That was a little bit further back in the webinar. We covered that closer to the beginning. So for any reason you missed that, head on over to our YouTube channel. We have a video called Medicare and Employer Coverage. So if you didn't get enough of this face in your life today, you can go see my talking head on YouTube, and I walk you through all of that in a video on YouTube about how those employer works with your coverage depending on the size of the employer. Let's see. Don't Medicare benefits backdate 6 months? I was told I have to stop contributing to an HSA 6 months prior. Yes. So in the scenario where you have a high deductible health plan and you delay all the parts of Medicare, including Part A, when you finally do sign up, let's say you sign up at age 68 for you're getting ready to retire, they're going to backdate Part A by 6 months. So you do want to stop contributing into that HSA 6 months prior to the time that you are going to get on Medicare Part A. Now, let's say you missed that. It's not a problem. You can actually contact your HSA provider and explain what happened, and they can reverse out that contribution for you. But that's a good question. It doesn't affect a lot of people, but you're right. I'm glad that you're aware of that. Joanne says, even though it's his employer or mine. So it never matters whose employer. It just matters you have group health insurance with a company. Doesn't matter if it's your company or your spouse's company, employer. Does the company have 20 or more employees? So it doesn't matter who the primary policyholder is. It just matters that you have health insurance with a company that's either a large company or a small company. Okay, so I see some questions came in on the Q&A, so I will flip over to that, and then you're also still welcome to put them in the chat, and I'll come back to those. Does the monthly premium for Part B for higher earners take location into account? The amounts listed are not a lot of money in certain parts of the country. Well, you're right about that, VJ, and I have actually never even thought about that, but that's so true. I mean, you need a lot more money to, say, live in New York than you would perhaps in Oklahoma. But unfortunately, no, they're just based on an annual number that they put out. Currently, that is 106,000 for single filers and 212,000 for joint filers. That's the threshold you have to stay under to not have the income related monthly adjustment amount. That is going to change a little bit every year. So here in a couple of months, they're going to release what the new numbers are for 2026, and that income threshold will probably go up a little bit, but there's nothing relative to where you live. Craig says, I have insurance through the federal government and I don't think I need to have double coverage, and I've not signed up for Part B. It's very hard to find the answer. Most articles only discuss options. Yes, that's right. So Craig, if you go to my YouTube channel, I actually have a video there on federal employee health benefits and Medicare. And so for you, you have the choice. You can have just Part A and also federal employee health benefits. And in that scenario, you're going to have a little more out of pocket because you're going to pay copays for all of your outpatient things. You could also have Medicare A and B. And in that scenario, you're paying a premium for Part B, but Part B is also going to kick in and pay a lot of those little copays and deductibles for you. So it's really your choice whether or not you want to enroll in that. Now, if you change your mind down the road, just be aware, let's say in 2 years, you think, I'm having a lot of copays here. I think I am going to sign up for Part B. You have to wait till the general enrollment period, which runs from January 1st to March 31st each year, to sign up for Medicare Part B, and you'll have a penalty. So for every year that you could have been enrolled in Part B and you weren't, for every 12 months, they're going to add a 10% penalty on top of whatever your premium is that you are paying for Medicare Part B. So the only caveat to not having Part B is that if you change your mind later and you add it, there would be a penalty. But if you're on your federal employee health benefits and you're not running into a bunch of copays and you can totally handle those, you don't have to sign up for Medicare Part B. And you definitely don't need a Part D drug plan because the federal health plans are pretty robust and they have good drug coverage. VJ said, you say you don't work in New York. That is correct. We don't. Unfortunately, New York will not license partnerships, and we are an LLP. And so I would have to start a separate corporation in order to do business in New York. But you can contact our office, and I have a great agent that I've been working with for years. She is in, I believe, South Carolina, but she's licensed in New York. And she's excellent, and she takes really good care of referrals that we give her for people in New York. Melissa's going to work until full retirement age with more than 20 employees. I think I'll delay both A and B. Do I need to file any form at Social Security at 65? So you don't need to do anything to delay. You'll just wait to enroll. And the only reason not to enroll in Part A would be if that company insurance is a high deductible health plan and you have an HSA. If it's not, then it's actually to your benefit to sign up for Part A and let that coordinate with the employer insurance, because in the event of a hospital stay, it will coordinate and potentially lower what you would spend on any inpatient type of charges. My Medicare and Medigap start on October 1st. I'm currently on the marketplace. How soon should I call to terminate the insurance? I would call now. You could let them know it's already September. So you would just call them and say, I turned 65 and I've already signed up for Medicare and I want my marketplace plan to terminate on the 31st or 30th of September. My husband's on Medicare because of disability, but is turning 65. Can he just stay on his Part C plan that he already has? Yes, he can. He would also have the opportunity to switch to Medicare and Medigap, and he'll then qualify for the rates that a normal 65-year-old would get for Medigap, which is a lot cheaper than if you have Medigap plans when you're under 65 on disability. So he would have both choices, but yes, he can keep his current plan. If I choose a Medigap plan through a carrier, does that get shopped annually or is it one and done? So you can shop it annually. If you enroll directly with an insurance company, then to shop it, you will need to either call around and get quotes or work with a broker like us. If you enrolled in that plan through Boomer Benefits, our clients will usually call in and say, "Hey, I got my rate increase letter. Can we shop it?" And we help you shop it every year. My team also makes outbound calls twice a year to all of our clients just to check in and find out, hey, have you had any rate increases? Anything we can help you with shopping? And so that service is available to you through our team if you go with us. My husband and I are on Plan F. Can we call now to discuss our options or should we wait until open enrollment begins? So remember, the annual election period in the fall or the fall open enrollment has nothing to do with Medigap at all. So if you're wanting to shop your Plan F, potentially to move to a Plan G, which might be lower premiums, you can do that now. You don't have to wait until open enrollment. And in fact, I would tell you it's never good to shop your Medigap plan in the open enrollment period because that is the time of year when underwriters all across the country get slammed with thousands of applications and they're grumpier than usual and you have more denials than usual. So you should never shop your Medigap plan between October 15th and December 7th. But what you will shop in the fall is going to be your Part D drug plan. So if you're wanting to shop the Plan F, I would actually do that prior to October 15th. Is there a way to have a small company employer help to pay Medicare premiums? My understanding, and I'm not familiar with group insurance very much, but there is some sort of reimbursement that they can set up. I think it's called an ICRA, where it goes into an account and then it reimburses the premiums that way. There are some rules surrounding that. So the small employer would want to contact their insurance company, whoever the broker is that sold them their small group insurance, and inquire if they would have that option. I turned 65 in March. How soon in advance can I apply for Medicare? You can do that 3 months before your 65th birthday. So for you, that would be in December. Yeah, January, February, March. Yes, in December will be the earliest that you can sign up for your benefits to start on March 1st. If I continue to work till full retirement, can Boomer Benefits help me if I should delay the Part A and just use my employer health insurance or sign up for Part A and lose the HSA? For sure. Yeah, we can. You can call us and we'll go over those and help you with that. Let's see. Barb said, I need to take some money from my 401k. Is there a threshold for IRMA trying to stay under that? Yes. So there is a chart that I put up when we were covering that section. And I will pull it back up and I'll share that here in just a second. But you can also go to boomerbenefits.com and go to the Medicare costs page. And we have that chart on there and it's updated every year. So currently that limit is 106,000 for single filers and 212,000 for joint filers. That's going to be based on your 2023 income. And we won't know what that's going to be for 2026 Medicare based on 2024 income until they roll those numbers out, which will be late October, early November. And I live in New York. Can you share your trusted contact? Yes, I definitely can. I'll tell you what, I don't have her information here, but I can get that information to Jeff and then you can connect with him and you can reach out to her. Her name is Thea and she's a great agent and she can help you with a New York enrollment. And I think that's all of the questions so far. Anything else that I
So
missed?
we've got all the questions. We're going to close out that Q&A session. And I think a couple more popped in
Oh, yeah.
the comment section.
Okay. How do we contact your agency? Just go to boomerbenefits.com and our phone number will be right up at the top of the website and you can call in there. Our receptionist will ask you what state you live in and then they'll connect you with one of my team members. The other option is you can go to our Medicare Q&A with Boomer Benefits Facebook group. And when you get inside the group, you can post and just say, I'd like to work with a Boomer Benefits representative, and one of the team members will message you and connect you. So they'll be able to do that. Let's see. I also was going to do a book giveaway. So let's do that before I forget. I've actually done that once before where I totally forgot to do the book giveaway and I felt terrible afterward.
This
So
group will not let you forget.
okay, good. If you're still here, if you would just type into the chat box, still here, and we'll give it a minute or two for all those to come in, and then I'll just spin the wheel here and we will choose a random lucky person here to get this book. And if I miss any of your questions too, if I happen to miss a question or you think of one later on, don't forget you can come and talk to me in the Facebook group and I'll get them. And wow, you're right, Jeff. We did have everybody say, look at how many people
Yep.
are here. That is awesome. I'm going to give it just a minute because I see some still rolling in. Okay. Looks like the tide has stemmed here. Okay, let me scroll my wheel here and then I'll pick whoever is at the top. So the winner is Laura Ergel. I hope I pronounced the name. Is that Laura or Laura? Um, anyway, that is the book winner. So Jeff, did they have a way of getting you their information, and then I
Yeah.
can get that for you to mail it?
Yeah. So just send me a private message and we'll take care of it. Don't worry about it. We'll make sure you get
Perfect.
the book.
Hope you enjoy it. That's awesome. And I think that's it. That's a wrap.
Well, Danielle, cannot thank you enough. Now, seriously, and it's an honor and a privilege to have you come in and present to this group. I just have one question for you.
Sure.
When can we get you back to do this again? Because not everyone could make it.
Yeah, sure. I'm happy to do it again. If you've
Okay.
got a group that missed it, we can do that. If we were to wait, say till like no for early November, we'll have all the new numbers for 2026. So
Okay.
that might be a good time to do it before the annual election period ends. But once we have all the new numbers, and that would leave people an opportunity to still make decisions in the annual election period, or we can do one in the new year, whatever works for you.
Awesome. Really appreciate it. Thank you. And for the rest of you guys, some people asked about recordings. We decided to live stream this event into the group. So the live stream is there right now, and you can go back and watch it at your leisure. Again, thank you, Danielle, and have a great day. Bye,
Bye,
everyone.
everyone.